program. As the province exits the COVID-19 fourth wave, authorities say 53% of the adult population in the province have received at least one vaccine dose. With a decrease in vaccinations over the festive season, the province expects the numbers to now start increasing again. The panel for the Digicon will consist of Premier Alan Winde, the Western Cape Health MEC, Dr. Nomafrench Mbombo, and the head of the Department of Health, Dr. Keith Cloete. Let's take you there live.
Decrease week on week into the last week. So we're currently just about 2,000 cases per day over the last 7 days average. Smear positivity has come down to 40%. And then also a decline now starting to see of admissions. It's peaked at 217 admissions per day and it's starting to decline now. And then also early signs of a decline of deaths, but we've seen about 25 deaths per day. So when we get to about 600 new cases per day on a 7-day average, we would have exited the fourth wave. So we got a way to go over the coming period to get there. Metro patterns has been a downward trend in all the sub-districts in the metro. We go to rural, you'll see West Coast and Central Karoo are stabilizing and plateauing, but the others are decreasing similarly to the metro. If you go to reproduction number, that is now solidly below 1, and that's in keeping with a continued reduction in new active cases. Our short-term prediction from the South African COVID Modelling Consortium was a median of 777 cases per day for this week. But as I said last week, that was also influenced by the testing patterns over the festive period. So we have seen significantly higher cases. So our median is about 2,000 active cases over the last 7 days. But you can see their prediction then for next week is a little bit higher than what we have now for this week as a prediction, but it is lower than the actual cases we've seen. So their prediction, we believe it will start up, numbers will start approximating their prediction, and we're expecting to drop to about 1,000 or just below for next week. If you look at Omicron generally in South Africa, Omicron is now been virtually the 99% in December, all cases that was done in sequencing is Omicron. If you go to Western Cape, also all the cases in December is due to Omicron. The MRC excess death, we always we track our deaths against the MRC excess death report. This is till the 8th of Jan, so it's the end of last week. And you'll see it's above what is called the predicted bounds of expected deaths for this period, but that's also what we're tracking against, and we're expecting that for this week to start plateauing and start going down, and obviously every week we'll check against the MRC. So the big questions we've been asking over the last few weeks is, are we seeing fewer admissions and fewer deaths? And this is the decoupling has been clearly established in this province to the right-hand side. It started in the third wave, but it's now very much in the fourth wave. So what you're seeing here is that cases were 14% higher in the fourth wave compared to the third wave, but new admissions is at 63% compared to the third wave peak. Deaths is at 24% compared to the third wave peak. And obviously, there is now some data to suggest that Omicron may be less severe than Delta, but as I will show in the slides coming up, we have now looked at our data, and the majority of that is because of a reduction of severity is because of prior infection and vaccination. So this is, we're also very proud of our scientists in our province, and this data is just about being released in scientific journals. So we are showing you the comparison of disease severity in the fourth wave compared to the third wave. And the top column, the blue circled one, is death or admission taken together. The bottom one is death only. And what we're proving here, if you look at the top one, unadjusted, and I'll explain what unadjusted means. Unadjusted means we've taken into consideration the things that we've normally looked at in the first, second, and third wave, which is age, sex, comorbidity, sub-district. And in that, we've looked the third wave compared to the fourth wave compared to fourth wave, unadjusted for anything. There's a 2% 2 times lower risk. So it's a 2 times lower risk of being admitted or having a death. If you only take deaths, it's a 3.7 time lower risk of having a death in the fourth wave compared to the third wave. Now, the finding that we publish in this paper is if you then adjust that for reinfection that we know of and for vaccination, you can see that the risk then drops to 1.4 for death and admission, and it drops to 2.4 for deaths only. So what does this mean? It means that if we take account of the people, whether they've been had the reinfection and we know about it, and they've been vaccinated, you can see that that is a big reason why we have fewer deaths and we have fewer admissions. So this reduction then suggests to us that immunity from vaccination and or prior infections are the key reasons for the milder clinical picture that we're seeing from Omicron. But because of this data, it is probably also, if you take those two away, there is still a 1.4 times lower risk for infection and admission, and a 2.4 just for death, if you've taken those two factors away. So there's early suggestion here in this data that Omicron itself may be less severe than Delta in the previous wave. The second one then, which is then specifically the question, how much protection are vaccine providing to people with COVID infection in the fourth wave compared to the third wave? Again, if you look at the top one, it's death alone, and if you look at the bottom one, it is admission and death together. So what we're showing here is we're showing what the impact of vaccination was in the 14th of November to the 11th of December, which is the Omicron period, the fourth wave. You can say, for death, that vaccines gave a 3.8% lower risk of dying if you are fully vaccinated in the fourth wave, compared to 3.2% lower risk if you were fully vaccinated in the Delta period, which was the third wave. If you then look at admission or death together, you'll see 2.7% lower risk in the Omicron period compared to 2.6% lower risk in the Delta period. So this really just gives you that compared to unvaccinated people, fully vaccinated people have a 3 times less risk of admission or death, or a 4 times less risk of death, which is unambiguous data to prove the value and the benefit of vaccination. So how much protection did we then have before the fourth wave? So this is the other factor, the factor about previous infections. And we have previously on this Digicon reported where the dotted red lines are what we called seroprevalence studies, which means we looked at blood samples to see for the evidence of antibodies against COVID. And what our previous experience was, whenever we took it after the first wave, before the second wave, after the second wave, and that was before the third wave, we've always seen, every time we've taken the seroprevalence survey, that in the blood samples we tested, the proportion of people with antibodies was always increasing successively as we went over the wave. So what was the results this time around? We looked at the bloods that we normally collect for diabetics in the private sector and public sector. Also people that has HIV care that comes in for routine bloods, and also children that comes for routine care at our public sector hospitals. So what is the result? So now this first part, it's called anti-N antibodies. This is a specific antibody that we look in the blood samples to see that there is evidence of antibodies because of prior infection. This antibody is not generated by vaccination. So what you see here is that this is quite high in public sector diabetics, and that was about 75%. In people with HIV, it was above 70%, and in people children that comes to public sector hospitals, it was about 63%. The big difference here is that for bloods taken of people that attended for diabetes care in private sector, it was significantly lower. So this means that the exposure of people to previous infection in more affluent areas were much lower than in less affluent areas. And therefore, if you just look at this from prior infection, you would say that people that in the private sector is then significantly more the risk from severe impact of COVID in the fourth wave. But what we also did is then in the same blood, look at something called anti-spike antibodies. Now, this is another antibody, but this one is a combination of whether you had prior infection or vaccination. So this antibody tells you it's a different antibody and it is generated by both prior infection and by vaccination. And what we see from this analysis, literally through the board, that overall about 90% of adults, now that is public sector and private sector and people living with HIV, more than 90% or close to 90% of all of them had immune protection from prior infection and or vaccination before we entered the fourth wave. So this is a very important finding for us. It says that the levels of protection before the fourth wave was very high from a combination of previous infection and vaccination. Obviously, the children would be lower because in the children's case, many fewer children were vaccinated to give that kind of protection. So then the next question we ask is a very important question for us. Has the disease profile of COVID-19 changed between waves for those admitted and for those dying because of COVID? So again, we just remind you of the decoupling. And the key question is whether the profile of people that were admitted and died from COVID has changed between the waves. So this is another finding from a group of our scientists also being published today, that there's a lower absolute number of deaths occurred in the fourth wave. Obviously, we knew that. But there were these reports from the clinicians that somehow the deaths and the profiles were different. So there's a rapid analysis that was done. So what we did is we took the first 50 deaths that occurred in public sector admissions. Once we've gone over something called 5 admissions per million population. And for the third wave, that happened to be from the 15th of June onwards. And for the fourth wave, that happened to be from the 6th of December onwards. So we took the first 50 deaths in both those two periods. We got 2 clinicians independently that's very experienced working with people with COVID. And then we looked from all the data we could gather and came up with 4 categories. A clear category called COVID disease, where there's clear evidence of COVID pneumonia. COVID-associated disease become very evident in this analysis because there was no evidence of COVID pneumonia, but there were other underlying conditions, and that COVID precipitated an acute admission. DKA stands for diabetic ketoacidosis, for strokes, for TB, for cancer, etc. Then there was a category which was purely incidental, where it was clearly that the COVID test, positive test, had nothing to do with the death. And then the last one, the indeterminate, is that because of the data we had, we couldn't make a classification either way in terms of the data we had. So what were the profile that we found? So the blue ones is the third wave. The orange ones is the fourth wave. So from the blue ones, you will see that 78% of cases were in this COVID disease, or what we call COVID pneumonia, in the third wave. But that dropped to COVID pneumonia to 50% in the fourth wave. That's a significant difference in terms of the profile. But in the fourth wave, there is a bigger increase in this category called COVID-associated deaths. And there's about 24% in the fourth wave. And 1/3 of those were people with cancers and 1/3 of people with TB. So they had those underlying conditions, and because of COVID, it exacerbated an admission for them in terms of that. But there was no COVID pneumonia. The indeterminate is we couldn't classify, and then you can see incidental was actually less than 10%, but it could be more because of the indeterminate group that we didn't have enough information to make that call. So what does it look graphically? It looks at the COVID disease, which is green, is significantly higher in the third wave, and it's been down to 50% in the fourth wave. But this category called COVID-related is then higher in the fourth wave. And there's a new category called death due to incidental finding of COVID. So this corroborates with the experience from clinicians and also with our picture of the oxygen use, because oxygen use has been considerably lower in the fourth wave, which means there were fewer people that came with COVID pneumonia, and we can extrapolate that. Therefore, we now need to be very careful about how we interpret COVID deaths, because the profile of a COVID death, what we classify as a COVID death, has now shifted between the third wave and the fourth wave. And this is important for future monitoring of deaths related to COVID or other causes of death. So what's the summary of all of the latest evidence? So Firstly, there's clear evidence that there's reinfections with Omicron. Number two, there's a large proportion of the population in our setting, nearly 90%, that had protection against severe disease from prior infection and or vaccination before we entered the fourth wave. There's also a proportion of cases with severe disease to date that has been lower, and a different disease profile with less COVID-19 pneumonia. And it's mostly due to strong protection against severe disease from prior infection and vaccination. There's growing evidence that Omicron may cause less severe disease than Delta in unvaccinated people without prior infection. So while this proportion with severe disease is smaller, as most people have now some protection, for the ones that don't have a protection, we still see severe cases with Omicron. It's just much fewer, but there is still severe cases with Omicron. So the vaccines continue, therefore, to be the big, strong protection against severe disease for Omicron and remain our best defense, even if we're going to have different variants emerging over the months to come. So we continue then to follow the emerging evidence and update it as we go. So from a COVID-19 fourth wave response, I can just say we've always said this, that we wanted to have a triggered response to the fourth wave. And our first trigger was really the most sensitive marker we could use was a more than 50% increase in the pre-COVID oxygen use compared to when we hit that 50%. If we hit that mark, we would then say, okay, we go to the second warning, third warning, fourth warning. And we were about to bring additional capacity into our system if we were going through those triggers. So what has really happened? Our current picture is the hospitals are full, but you will now see in the second bullet that COVID and PUIs and public sector hospitals only makes up 13%. So 87% of the hospitals are full with other conditions. And that is the big point that we also want to make, is that other conditions, because of the de-escalation of services, the other conditions, more people are presenting to our hospitals. And COVID currently only makes up 13%. And as I've just shown, even in that 13%, not all of them get COVID pneumonia because they might have other conditions as well. And then intermediate care, Brackengate Hospital is now down to 95 patients. That is now coming down steeply. It was about 150 last week. So you can see that's part of the hospital decline. Mrs. Bay Hospital at 37, and the others are much less. The Mass Fatality Center has been closed, and as there's no need to open it because, as you can see, there were significantly less deaths in this wave compared to other deaths. This is our dashboard that get updated, and I think the big point of the dashboard is that as we have fewer COVID patients, it doesn't mean the hospitals are empty. There is people presented for other conditions, but there is no pressure on the right-hand side on the designated COVID wards we still have, which are getting less and less, and also our designated COVID capacity for critical care. So this, what do we say about persons in hospital then? So this is a very important one that we're looking at here, and this is the total admissions at any given time, what we call the point prevalence for public sector hospitalization. So we're comparing here the second wave peak to the third wave peak to the peak of the fourth wave. So you can see that 2,197 was at the 4th of January at the peak of the second wave. 2,126 was at the peak of the third wave, which is 3rd of August. And we peaked at 1,098, just over 1,000 on the 28th of December for the fourth wave. So that's a very important one for us. But also what the figure to the top shows is the rate of increase and then the rate of decrease of hospitalization. So you'll see the second wave, it went up quickly and it came down quickly. It went up reasonably slowly and there was restrictions and it came down firstly quite rapidly and then a little bit slower. The third wave was a much slower and an elongated wave. It increased slower and it decreased slower, and it seemed to have gone on for more. I think many people on this Digicon asked us, why does the third wave seem that it's going on for so long? And the fourth wave, you can see it went up much steeper in hospitalization, and it came down much steeper. So that is really also to show now we're at that point where the percentage increase is now hitting zero, and we're expecting, and it's starting to go below zero, so we are seeing a decrease in percentage increase. So what does it mean? The one we track is something called new admissions. So that is if we add new admissions. So again, if we compare the new admission peaks, it was 369 was the day with the biggest new infections for public sector on the 28th of December. And 297 was new infections on the 3rd of August. But you can see by the 4th of January, the biggest we had was 186. That was the biggest, and it's coming down. So if you then look at what does it mean for oxygen consumption, and this explains our trigger system. So what this graph does, it takes the baseline oxygen use. So it's about 12.2 tons. That was about in April. And then it takes it then down. If you look at that, what does then happen to the oxygen use? And when if it's more than 50% in the baseline, it triggers the first one, second one, third one, fourth one. We go up. You can see in the fourth wave to the right-hand side, we have never gotten to 50% increase of oxygen use. It only got to 39.7%. So we have not even triggered our first warning system. And just to give you a comparison, at the peak of the third wave, 200 patients was on high-flow nasal oxygen on that day. And now at the peak of the fourth wave, only 30 patients were on high-flow nasal oxygen. It gives you the comparison of the oxygen use that we saw of the 4 waves. So what this means for this graphic is we never fully even activated the first warning system. The health system coped, and we didn't have to activate additional capacity to cope with COVID. Just to go over to trauma, over the last 4 weeks, we've also been obviously looking at trauma, and we've been now seeing more than 10,000 trauma cases at our 20 emergency centers. There was a peak in the Christmas weekend, was repeated in the New Year's weekend, but you can see in the first weekend of January, it's dropped down again. So there's a 12.8% decrease in trauma cases week on week in the first week in January, and a 23% decrease on the weekend trauma in that period. What does that mean for trauma admissions? You can then see similarly, the trauma admissions went up initially, and then trauma admissions for the first week in January has now dropped down, and the trauma admissions for weekend admissions has also dropped down in the first weekend in January. What does it mean for healthcare workers? We can say that our healthcare workers had the highest infection in one single month for healthcare workers because of Omicron in December. But much fewer people obviously was hospitalized, and much fewer people died than compared to December last year, where we had a high proportion of cases. So there's only 757 active cases for healthcare workers now. That's significantly lower compared to the 1,600 we had about a week ago. And that means that in quarantine and isolation, we only have 758. I say only 758. 758 still affect our ability of rendering healthcare services, and 596 of that was for clinical staff. And the breakdown is given between doctors, nurses, and other categories. And really, we're still waiting for the national revised quarantine and isolation guidelines, but we are starting to see that staff returning. We are now being able to deploy our staff and render the healthcare services as well. So that brings me to vaccine implementation. So as of yesterday, 47.14% of the adults in the Western Cape over 18 were fully vaccinated, compared to 40% for the country. The vaccinations in the last week, that's the last completed week from 27 December to 2nd of Jan, it's 34. So we're seeing a first time an increase for 34,000 from a low of the week before. And vaccination in the last 24 hours is 10,000. So we're seeing also an increase in the first 3 days of this week. Registration breakdown, we have now reached 50% of everybody over the age of 12 actually is registered on the system. And you can see the breakdown between over 60 is much higher compared to 12 to 17-year-olds. And then also the registration over 18s, the breakdown in the metro showing the Western sub-district at 85% almost, but you still have the Tygerberg, the Mitchells Plain, and Khayelitsha under 50%. And in the rural districts, Overberg is the highest at 64%, but Central Karoo is still below 50%. So what is the vaccine administration per week? You can see that we had a very high vaccine administration in August, where we did almost 275,000 vaccinations in 1 week. There's been a steady decline from that August figure. And when we got to December, in December, it dropped below 100,000. And you can see we went down to the week between Christmas and New Year, down to 24,000. Last week, it went to 34,000. For the first 3 days of this week, we're on 29,000. We're expecting to hit close to about 60,000 then. So if we go from 24,000 Christmas to New Year that week, the week after New Year to go from about 34,000 and hopefully 50,000 this week, we would like to see that that's the recovery of vaccination and the uptake of increased vaccination as well. So this is the cumulative coverage for people over 18, up to 53.52% for what we call the primary vaccination course. And we would obviously like to see that also to continue, not just the boosters. So this is then our status as of yesterday for unvaccinated people. So 46% of people over the age of 18 is still unvaccinated in this province, while 54% has had at least one vaccine. That breakdown of the unvaccinated, you'll see, is majority of those, 51% of that, which is 1.1 million, is 18 to 34-year-olds. And then it's a lower amount, about 600,000 people between 35 and 49, and then 250 between 50 and 59, and 200,000 of over 60. So we still have a significant amount of people that's unvaccinated, that has not had a single vaccine yet in the province, and our focus still continues to be on them as well. So this is the coverage per age group then for that, what we call the primary course, and you can then see that the fully vaccinated over 60 is 67%, 50 to 59, just short of 60%, 58%, and then it gets lower all the way down to only 2% of the 12 to 17-year-olds. And this the 50-year-olds above 50, which is our primary target. You'll see over 60, it's 67% of people, more than 2/3 now of over 60 are fully vaccinated, and Overberg leading with 90.59%. If you look at 50 to 59, just short of 60, as I said, 58%, and Overberg again 62% leading compared to other districts. And then 20 to 49, this is the other age group. You can see that less than 50% of people in that age group is fully vaccinated, or have at least one vaccine, sorry. And you can see that this is where we need to do a big catch-up as well as in the younger age group compared to the older age group. So our strategic focus is very much continue to be promoting equity target approach and then the renewing demand, but we're putting a much more stall now on the renewing demand and creation efforts, so that we want to get now to everybody that's unvaccinated and everybody that qualifies for a booster. That's our big focus, and we want to start the demand and make sure that everybody come forward again. So this is the update of the boosters and additional doses as of yesterday. So immunocompromised, 4,200 people have come forward for their additional shot. The general boosters, for Pfizer, it's now 9,800, and for Johnson & Johnson, also 9,800. That's just short of 20,000 so far. Pfizer is 6 months after the second dose. Johnson & Johnson is 2 months after the initial dose. As the pattern to the top continues, of all the people that has taken up the general boosters, more than 2/3 of them are actually people that are more affluent, that has medical insurance, which was the pattern initially with the first uptake with vaccines that we started off. And very heartening for us, of all the people that have come for boosters, more than 50% of them are over the age of 60, which is exactly the target group that we want to reach more than others in terms of protection and vulnerability. So what's the overall remarks of our vaccine implementation? The uptake has slowed substantially. We can't completely be certain how much of this is due to holidays, because we are experiencing similar slowdown seen in other countries. The targets will be reset for 2022, and it will be about primary vaccinations, so unvaccinated people, and then we'll have targets for booster doses. But very interesting from the data we showed today now, we also want to actually set targets linked to what is your protection versus vaccine booster and prior infection. So we want to work out what would that be, an index for protection going into the 5th and 6th wave. We want to retain our focus on the most vulnerable, a renewed mobilization for the whole of society to come forward. And then obviously we want our efforts to be guided by data and available evidence. And we will target geographic areas with low coverage and more vulnerability. We will reach the unvaccinated, and we promote boosters in the ones most vulnerable. In communication, it's keeping safe while we're exiting the 4th wave and generating demand for vaccine. That's our key communication at the moment. And the continued messaging on vaccine safety. And we continue to provide that information for everyone. So in conclusion, we are now seeing a decline in cases in the 4th wave in the Western Cape. We still have high numbers of active cases. So we urge everyone to vaccinate, wear a mask, avoid enclosed spaces, gather out.
An important presentation there, a decline in cases in the fourth wave in the Western Cape. But let's take you live to the story now. The remains of 17 people who were killed in